Hey everyone, if you're dealing with hip pain and it's affecting your workouts, this video is for you. You need to check it out. We're going to be talking about the top 3 things that you need to make sure get addressed in order for you to get back to your workouts pain-free. Make sure you take a listen. The answers might surprise you. Okay guys, before we get started on talking about the hip pain, I want to remind you guys, as much as we love making these videos, hopefully providing useful tools for you guys to implement, something we enjoy more is getting to work with you one-on-one. So if you live in the Ooltewah or greater Ooltewah surrounding areas and you're dealing with a problem, please feel free to reach out. We would love to help you get through a customized treatment plan to get you back doing what you love to do most. So the chances are you stumbled across this video because you're dealing with hip pain with your workouts and you're searching or hoping to find something that you can start doing, stretching, exercise that's going to make this hip pain go away. Now likely there are probably something like that out there for you. In fact, I've put out some videos myself as well as Jeremy to be helpful in just that. However, I'm going to take a little bit of different approach today, and I want to talk to you about really the best 3 things that you should go through in order to really fix this hip problem correctly so you can get back to the workouts you love. So we're not going to talk specifically about specific exercises or stretches, but more or less a process that I would highly recommend you go through in order to get back to doing these workouts. Okay, so number 1 is you got to figure out the root cause of the problem. Now, this could be a little bit tricky. You might be thinking, well, how do I figure out what the problem is? All I know is I'm having pain and it's affecting my workouts. Well, that's where you need to really connect with a professional who really knows what they're doing and knows how to root diagnose a problem, especially when it comes to your hip. Now, well, how do you do this? Well, your best bet is to hook up with a good physical therapist, really someone who knows and understands the activity or exercises or hobbies that you're going through. But bottom line is you need to figure out what the root cause of the problem is. This is best done by some good testing from your physical therapist or other healthcare provider to kind of figure out what's causing this problem in the first place. That way a game plan can be made when it comes to exercises, etc., in order to get this thing better. So let's figure out the root cause of the problem. Okay, so now let's get into part 2. We figured out the root cause of the problem, and that allows us to really hone in this next part. Now, I'm going to preface the second part with this. Even within the physical therapy world, there's much debate on what is better for fixing a hip problem. We have the exercise-based group of, hey, you need to do self-stretching and exercise. And then on the other end, you have the manual therapy group. And these guys say, well, you've got to manually stretch it. You got to manipulate it. And you have to pop this and stretch that and the other. Well, it turns out both of these groups are right. And the research is extremely clear in this. If you want optimal outcomes on fixing your hip pain so that you can move well, pain-free, and be strong and keep this problem from coming back, your best bet is to have a nice dose of manual therapy plus progressive, customized, corrective exercise. Now that's a mouthful, but basically what we're saying is we need some manual input to it, but we also need some corrective exercise under guidance in order to best optimize where you're going to get your hip back to so that you can get back to the activities that you like without having pain. Manual therapy plus exercise. That's number 2. That's process number 2 that I highly recommend you go through in order to optimize what you're going to get out of your hip. So this leads us to the third thing, and in a lot of people's mind, this may be the most important. In the third section, you got to learn what I call the tools to keep this problem from coming back. Ideally, with the manual therapy and progressive exercise, you're going to get this problem to go away, depending on the problem, anywhere from 6 to 10 visits for a lot of people. Hip's going to be feeling good. You're going to be back to your workouts, pain-free. But how do we keep this problem from coming back again? And that's learning the tools to keep this from coming back. And this comes down to what we're going to give you as a home exercise program, if you will, over the next few months on this is the little bit of medicine that I got to take daily in order to keep this hip problem from coming back get this thing at bay and keep it that way. That way, even if you have a little bit of flare up, you have some good tools to go to really nip it in the bud, so you don't have to go through this huge process of getting treatment for a setback of the hip pain. I can't tell you how many times as a PT that I've treated somebody, we get them out of pain, they're feeling good, give them some homework to continue to work on. I get a phone call from them 2 to 3 months later, Andy, my hip pain is back. We get them in, let's check it out. Sure enough, it's a similar problem. Hey, were you doing the exercises I gave you to work on at home? No, I wasn't in any pain, so I didn't think I needed to do them. Well, that third piece of learning and implementing the tools to keep this problem from coming back is hugely important. And that's where a lot of people miss the boat, whether they see a clinician or not. They may have found some stretches on YouTube. Hey, it made my hip feel better, so then I stopped. But they never got to the root cause of the problem. And then on the other end, they never learned the tools to kind of keep this problem from coming back, because they got out of pain, they went right back to doing what caused the pain in the first place. So learn the tools to keep this problem from coming back. So this 3-step process we just described to you is something we take our clients through every day. And this has allowed us to have a very high successful rate. If you are wanting some more customized help to help you with your hip pain or other injuries, please make sure you reach out. In the meantime, check out this description. There's some links in the description below that you can click on to give you some more helpful tips. And please also make sure you hit that subscribe button. This allows us to help reach out to more people. We're looking forward to hearing from you guys. See you next time.